Assalamu alaikum. Hello everyone. It's my honor and pleasure to be with you today as we start this course. My name is Yasser Al-Tahir and I'm an adjunct associate professor of anatomy at Faculty of Medicine, University of Kordofan. I'll be working jointly with Dr. Mohammed Kannan from University of Washington, St. Louis, United States. So let us have a quick overview of the course. In this course, we will be covering the following topics: the skull and the cervical vertebrae anatomy, as well the anterior triangles of the anterior triangle of the neck, the posterior triangle of the neck, the face and the skull, temporal and infratemporal fossa, nose and paranasal sinuses, oral cavity, pharynx, larynx, eye, and the ear. So these are the topics that we are going to cover during this course. First, let us cover the anatomy of the skull, and this topic will be divided into two. The first lecture will cover the different views of the skull except the inferior view, which will be added to the next session together with the base of the skull and the cervical vertebra. So let us start studying the agenda and the objectives of today's session. First, we'll provide an overview of the major anatomical landmarks, giving you a clear understanding of the external features and structures that form the foundation of this course. Next, we'll examine the skull and external structures in details, identifying the key phenomena and discussing the important features that pass through each one. And finally, we will highlight the clinical relevance of the skull anatomy, discussing the conditions and procedures that are closely related to the skull features. So before we dive into the details of our session, let's clarify some important terms that we will frequently use throughout the course. So we have the term norma, and norma refers to different views of the skull. So for example, we have norma frontalis, which represent the frontal view, norma lateralis, lateral view, norma verticalis, this is a vertical or top view, and so on and so forth. We also have the term cranial or vault or calvaria. It means the dome of the cranium or the skull cap formed by membranous bones. We'll see that in minutes. And the term sutures, and the sutures means the joints between the skull bones. And as you know that the sutures are a type of fibrous joint. We have also the term foramen, and foramen is any opening in the skull wall that allows for the passage of structures such as the nerves and blood vessels. For example, we have emissary foramen, a foramen that contains an emissary vein, and emissary veins that connect intracranial veins with extracranial veins. That means the veins from inside of the skull to outside of the skull. Okay, so this is an example of norma lateralis, which is lateral view of the skull, and here this is an example of a picture showing the clavaria and the sutures. So here we have, this is a coronal suture, this is a sagittal suture, lambdoid suture. Okay, and in this third picture, we'll see the foramina. These are foramina, and as well emissary veins that passes and crosses through these foramina. The skull, let's start by studying the skull. As I said, the skull is composed of 22 bones, okay? And that is not including the three ossicles in each ear and the mandible. We have three small bones in each ear and the mandible. These are not included in the 22 number of bones. These bones are categorized into two main groups. We have neurocranium and viscerocranium. So let us see what does that mean. Here, these are the bones that form the neurocranium, and here, these are the bones that form the viscerocranium. Okay, neurocranium, which is here, uh, uh, or the cranial vault, it serves to encase and protect the brain. Okay, it consists of 8 bones. Some of these bones are single, like the frontal bone, which form the forehead and the superior part of the eye and sockets. Other are paired, like parietal bones, which are located on each side of the skull and meet on the top to form the roof of the cranial cavity. Okay, the viscerocranium, uh, which is known as the facial skeleton, it comprises like 14 bones that provide the structures of the face. It houses important sensory organs like the eye, ear, okay, and it is also similar to the neurocranium. Some of these bones are single, such as the vomer, which is here, and it forms the nasal septum, and others are paired, like the maxilla, which is here, and the maxilla form the upper jaw and support the upper teeth. Okay, so in summary, this is the viscerocranium, and this is the neurocranium. Okay, we'll start studying the different views of the skull by studying the norma frontalis. And the norma frontalis refer to the view of the skull that form the front. Okay, it primarily include the frontal bones, okay, or bone, zygomatic bones, because there are two, nasal bones, which is here, also two, maxilla bones, which are also two, and mandible. Okay, understanding these bones is essential for comprehending the structure that passes through this area. The frontal bone, which is the first one, form the forehead and the upper part of the eye sockets up to here, and the roof as well of the eyeball. The key features of the skull, of the frontal bone are the superciliary arch. We have a small arch, which is here. It's more prominent in males than in female. It is called superciliary arch. Okay, and we have also supraorbital foramen, or sometimes called notch. These are the supraorbital foramen or notch. It passes the supraorbital nerve and vessels. Between the two supraciliary arches, we have an impression here, which is called glabella in this area. Okay, the glabella is an impression between the two superciliary arches. Below the glabella here, in this area, we have the nasion. And the nasion, this is the site of the suture that connect the nasal bones together with the frontal bone. Next, we have the zygomatic bones. These zygomatic bones are also known as the cheek bones, cheek, and they are located on each side of the face, and they form the prominence of the cheeks. Okay, infralateral part of the floor of the orbit. So they share also in the formation of the floor of the orbit. The maxilla makes joins with the frontal here, and with the maxilla here, and as well with the temporal bone, as we will see that in the lateral view. Okay, the main features of the zygomatic bone are the infraorbital margin, which is very important because it shares in the formation of the orbital cavity, and as well the zygomatic-facial foramina, which is here and here, and it transmits the zygomatic-facial nerve and vessels. Okay, and lastly we have the zygomatic arch, which is made of the zygomatic bone and as well frontal bone. Also, you can see here the maxilla, as I said, the maxillae form the upper jaw both and hold the upper teeth, and they have notable features such as the body, which is here, and four processes. We have four processes: the frontal process of the maxilla, which extend up to here, forming a joint and suture with the frontal bone, and we have the zygomatic process, which is here, extend to form other joint with the maxilla. We have the alveolar uh, process, which extend down, holding the upper jaw teeth, and we have also the palatine part of the maxilla, which forming the roof of the mouth. You cannot see it unless we open the mouth. Okay. Uh, Also, the maxilla form, as I said, the sockets of the maxillary teeth, which are found here, deep. And then we have the nasal opening. This is the nasal opening, which is also made by the maxilla bone and bridged by the nasal bones. Okay. We have also the orbital cavity. The orbital cavity, the maxilla share in the formation of orbital cavity. So in just minutes we talk about the roof, which is made of the frontal bone, part of the lateral wall, or actually all the lateral wall, and part of the floor is made by the zygomatic bone, and as well the maxilla share in formation of the base of the orbital uh, bone. Okay, we have also the nasal septum here, uh, and the nasal septum divides the nasal cavity into two parts, right and left, and we have the concha. This is superior, medial, and inferior concha. Okay, and the concha form the lateral wall of the nasal cavity, as you see. Okay, and finally, in the frontal view, we have the mandible. Okay. So the mandible or the lower jaw, it is the only movable bone in the skull. Okay, the only movable bone in the skull. It has two parts: the body, which is here, and the ramus, which is here. Body, which is here, and the ramus, which is here. The key features of the mandible includes the mental foramen, which is here, and it transmitted the mental nerve and mental vessels, and as well we have the mandibular foramen, which is here, and through this foramen the inferior alveolar nerve and vessels pass. Okay, as you can see in this picture, it includes all the details of what we said: frontal bone, zygomatic bone, maxilla, vomer, superior, middle, and inferior concha. Okay, and mandible, mental foramen, and so on and so forth. Okay, I have just seconds to have a look to this picture, summarize all what we said. All right, now let us study the lateral view of the skull, or the side view of the skull. And this view it allows us to see the interplay of several bones. The key bones visible on this view include the parietal bones, the temporal bones, frontal bone, occipital bone, sphenoid bone, zygomatic bone, maxilla bone, and mandible bone. Okay, so all these bones share in formation of the lateral view of the skull. So let us start by the parietal bones. And the parietal bones form a significant portion of the upper side of the skull. The key features include uh, parietal eminence, which is here. This is called parietal eminence, which is the most prominent point of the bone. And we have also superior and inferior temporal lines. The superior temporal line represent attachment for temporalis fascia, and the inferior temporal line represent origin for temporalis muscle. Okay. Then we have the frontal bone, which is here, and it form the forehead and extend to the eye socket, extend down up to here. Sorry, in the lateral view, we can also observe the coronal suture, which is here, join the frontal bone with the parietal bones, and the zygomatic process, which articulate with zygomatic bone here. This zygomatic process of the frontal bone. Okay. Regarding the occipital bone, which is here, it forms the back of the base of the skull. Okay. The key feature is the lambdoid suture, which is here. This is the lambdoid suture, which is a joint between the occipital and parietal bones, and the external occipital protuberance, which is this point. Okay. It's a prominent bump on the back of the skull, serving a muscle attachment point. Okay. We have the sphenoid bone, which is this bone, and it is a complex bone. It looks like a butterfly, located on the base of the skull. From the lateral view, you can see the greater wing. This is a greater wing here, and you can also see the extension of the bone downward. We call it trigoid processes, which is here. We have the trigoid processes lateral and medial. Now this is the lateral trigoid process. And the lateral trigoid and medial trigoid represent and serve important attachment for various muscles of mastication. We have the temporal bone, which is this one, and the temporal bone is characterized by temporal fossa, which is here, the external auditory meatus. This is the opening of the external canal of the ear. Okay. We have also the mastoid process, which represent as well muscle attachment, especially the sternocleidomastoid muscle, an important muscle and landmark in the neck. And we have this styloid process, which is lower down here. Okay. And finally, we have this bone, which is the styloid process of the zygomatic the zygomatic process, sorry, of the temporal bone, zygomatic process of the temporal bone, which articulate with the temporal process of the zygomatic bone, form the zygomatic arch. So this is a zygomatic arch. Okay. And lastly, we have the zygomatic bone. We talked about it earlier. We said that it forms the cheek, or it has the other name, which is called cheekbone. It is easily seen in the lateral view, and it features the temporal process to articulate with the temporal bone here, forms the zygomatic arch, and the frontal process, which connect the frontal bone. Okay. You can see also lots of details in this diagram. I prefer to explain first in unlabeled photo, and then to give you some time just to have a quick look at this labeled lateral view of the skull. Okay. Um, Next, let's talk about the pterion. Okay, a pterion, which is the thinnest area in the skull, located at the temple. It is where four bones of the skull meet: the frontal bone, the parietal bone, the sphenoid bone, and the temporal bone. All of them meet here in this point, which is called pterion. Okay. The significance of the pterion lies in its internal anatomy, internally inside the skull. Just beneath this region, on the inner aspect, lie the middle meningeal artery or vessel. Okay, this is the middle meningeal artery and its branches, which is found inside the skull. These vessels are crucial because in an event of head injury, they are at risk of rupturing, leading to a potential life-threatening bleeding. Okay, so when considering head injury, particularly those that affect the temporal region, understanding the anatomy of the pterion is and its associated structure is vital for diagnosis and as well for the management. Okay. Uh, Now in this view, this is the norma occipitalis, which is the posterior view of the skull. It offers clear perspective on the bones and the features that form the back of the skull, which play a crucial role in protecting the brain and supporting the head. So the most prominent structure visible on the posterior view of the occipital bone, uh, this single bone, which is occipital bone here. Okay. The majority of the backbone form the majority of the base of the skull as well. The key features are the external occipital protuberance, this prominence here. Okay, it's like a bump in the midline, which serve as attachment point for nuchal ligaments. These ligaments help support the head weight. Okay, attached here the superior nuchal line. Extending laterally from the external occipital protuberance, we have the superior nuchal line, which is here, and as well we have the inferior nuchal lines, which are lower down here. Okay, so these ridges are important attachment, as I said, sites for muscles as well in the head and neck, such as trapezius muscle and splenius cavities. Another critical feature visible on the posterior view is the lambdoid suture, which is here. Okay, the lambdoid suture connects the occipital bone with the two parietal bones. This suture has a characteristic lambda shape, from which it gets the name lambdoid suture. It also plays an important role in maintaining the structural integrity of the skull. Lambdoid suture. We also have the two parietal bones, which form the sides and roof of the cranial cavity. From this posterior view, you can observe how they meet in the midline and also with the occipital bone at the lambdoid suture. Okay, mastoid bone, which is here, although they are primarily visible on the lateral view part of the skull or perspective. These rounded projections located just behind the ear provide attachment for muscles like sternocleidomastoid, which is responsible for rotating and flexing the head. Okay. Now let us explore the superior view of the skull, which provide a clear overview of the skull vault or calvaria, as we explained earlier in this presentation. This view is mainly formed by parietal bones, two parietal bones, frontal bone, and a small portion of occipital bone at the back. Okay, so together these bones form the cranial vault, which is important encasing and protecting the brain. The superior aspect of the skull is dominated by the two parietal bones on the sides and the frontal bone in the front. Okay, so the main features are or include the sutures. So we have the coronal suture. This is a coronal suture. Okay, it runs horizontally across the skull, separating the frontal from the two parietal bones, and this suture play a significant role in the growth and development of the skull. We have also the sagittal suture, which is here, and it runs longitudinally along the midline of the skull, separating the two parietal bones. Okay, this suture extends from the coronal suture at the front to lambdoid suture here at the back, and divide the skull into right and left halves. At the junction between the coronal suture and the sagittal suture, we have this area which is called brygma. And it's a crucial also anatomical mark, and this point often used in neurosurgery procedures. We also have the lambda, which is here, and the lambda is the site where the sagittal suture meet with the lambdoid suture. It also has a clinical importance. Okay, we have the fontanelles, and the fontanelles are membranes of unossified gaps between the large bones of the skull. Okay, so we have the anterior fontanelle, we have the posterior fontanelle, and the anterior fontanelle closes in the infant at the age of 18 months, and the posterior fontanelle closes at the age of 1 year. Okay, we also have the sphenoid fontanelle, and we have the mastoid fontanelle. The importance of these fontanelles is that they allow the head to deform during its passage through the birth canal delivery, and also they allow the postnatal growth. Okay, the baby brain growth and head growth mainly take place due to these openings. Finally, take-home messages: the skull is a complex structure composed of 22 bones that protect the brain and support the face and provide attachment point for muscles. Okay, each view of the skull, superior or posterior, lateral, anterior, or even inferior, reveals specific bone structures and landmarks that are crucial for understanding its anatomy and function. Although understanding of these different perspectives is essential for anyone studying human anatomy. At the end, thank you for listening and understanding. See you in the next recording. Bye.